Globally, excess salt consumption, defined as more than 5 grams per day, is responsible for 3 million deaths from heart disease, stroke, and related causes each year. 4 out of 5 of these deaths occur in low and middle-income countries, and nearly half are among people younger than 70.
Most people consume around twice the recommended amount of salt a day, yet many are not aware that the amount they are eating is raising their blood pressure and potentially shortening their lives. In many Western countries, 3/4 of the salt eaten is hidden in processed foods, while in low and middle-income countries, it's mostly household salt, used during cooking or at the table.
As most dietary salt in China is added at home during food preparation, it can be easily substituted with a healthier option, such as a salt substitute. So, we conducted a 5-year study there involving 21,000 people across 600 rural Chinese villages to try to figure out the health benefits of using a salt substitute.
With salt substitutes, part of the sodium chloride in regular salt is replaced with potassium chloride. They are an effective and low-cost way of lowering blood pressure. But their effects on outcomes like heart disease, stroke and death were unclear. Until now.
Based on the results of this study, we estimated that 400,000 premature deaths could be prevented each year by national uptake of salt substitute in China. Salt substitutes are one of the most exciting opportunities in salt reduction. If salt substitutes were adopted worldwide, several million premature deaths could be prevented every year.
So through the WHO Collaborating Centre on Salt Reduction, we've generated evidence to guide governments to effectively implement and measure the progress of salt reduction strategies. While we found more countries are taking action on salt, only a small proportion have decreased actual salt intakes, and no countries have met the World Health Organization 2025 target of a 30% reduction.
Millions of lives and billions in healthcare costs could be saved if more governments act and translate this research into effective policy. That's why we're continuing to work with policymakers to sharpen their targets and push them to make them mandatory.
Much more work needs to be done to achieve global salt intake targets and to realise the true potential of proven solutions. While salt reduction is now higher on the agenda in many countries, our research shows we need radical action by government and industry if we're to realise the massive health benefits that could be achieved by reducing salt intake. What we need is global action. The time to act is now.